So we're going to finish up by talking about the role of pheromones, and we're going to start by talking about them in rodents. So we know of several different pheromones in rodents. There's pheromones that come from females, and there's ones that come from males. So there's one from females, and this one tends to suppress ovarian function in other females. So it's thought to suppress luteinizing hormone and follicle stimulating hormone from the pituitary. So when they're exposed to this pheromone from other females, female rodents will suppress the ovarian function. The other pheromone from males can actually accelerate ovarian function. So it accelerates puberty, can induce estrus, or interrupt pregnancy, depending on what's going on. And so what happens here is there's an abrupt release of luteinizing hormone, stimulating follicular growth. So if the rodent was already pregnant, this would interrupt pregnancy basically and cause an abortion by stimulating the process to start over again with estrus. So here's some of the effects that we know about mediated by pheromones that we can observe in the lab. There's the Lee-Boot effect. This is when we have female mice and we house them in groups with no males. They start to display longer estrus cycles, again, because they're suppressing that ovarian function. The Witten effect is having female group housed mice and having them be exposed to male or just the male pheromones, the odors. And what will happen is those group housed female mice will start inducing gonadotropin releasing hormone release, and they'll induce estrus very quickly. Kind of the flip side of the Witten effect is that if you expose these group housed female mice to female urine, we will suppress the gonadotropin releasing hormone and suppress estrus. The Bruce effect is probably the most well-known pheromone-mediated effect in the lab. And this is where pregnant females will abort or reabsorb their fetuses if they're exposed to other males or other male urine or odors that was not the father for greater than 48 hours. It'll induce that spike of gonadotropin releasing hormone, spike of luteinizing hormone, and cause kind of estrus to start to occur. And that's incompatible with pregnancy. The reason this is probably the most well-known one is because in the lab, if you're breeding mice for research purposes, you have to be very careful about tracking in other odors or accidentally introducing a new male to the colony because you could ruin your entire breeding program. And then there's the Vandenberg effect, where female juvenile mice exposed to adult males or adult male urine will actually induce kind of puberty sooner than others by maturing, starting that gonadotropin releasing hormone. Flip side of this one is exposure of female juvenile mice to adult female or adult female urine will actually inhibit that gonadotropin releasing hormone release and will inhibit puberty from occurring. So this is all very well established in rodents, but what about humans? So this effect is called the Wellesley effect. It's that women who live together for long periods of time will eventually start to synchronize their menstrual cycle. And it's been observed that it takes about 7 to 8 months of this cohabitation, living together for a long period of time before we see this synchronization occurring. So this graph I'm showing you on the right is actually from the first study looking at this. We're looking at the group synchronicity score and over time as things went on. This was actually done by Martha McClintock. She's a huge name in the endocrinology world, but she did this study as a senior at Wellesley College, which at the time was an all-girls college in Massachusetts. And she did this as her senior thesis. She convinced all 135 of her dorm mates to keep track of their menstrual cycles for the full academic year. Her work was actually eventually published in Nature. So her senior undergrad thesis was turned into one of the top tier publications for this work because no one had ever established the role of pheromones in humans before. So by looking, so we're starting here in October and going all the way through April, and we can see that we're starting to get more and more in sync with the menstrual cycle. Interesting tidbit to this effect is that Hillary Clinton was a senior at Wellesley at this time, and she was in the same dorm as Martha McClintock. So presumably she participated in this seminal study on human pheromones, but she has never confirmed nor denied if she participated in this study. So even though McClintock did this study originally way back when, we really didn't have a lot of evidence of human pheromones until 1998. So McClintock actually continued her work in this field, and she's the one who gets credit for this now. So in this particular study, McClintock had women provide chemosensory samples. So basically, they wore pads under their armpits for at least 8 hours a day, and then other women would smell the pads. Okay. But she had them wear it at different times of their menstrual cycle. And what we found was pads from follicular phase accelerated the surge of luteinizing hormone. It shortened the menstrual cycle of women who are exposed to the follicular phase pads. Pads from ovulation, the smell, the odor, actually delayed the luteinizing hormone surge and lengthened the menstrual cycle of recipient women by 1 to 12 days. So this is just showing you exposure change in recipient cycle length, and it got longer if they were exposed to the ovulatory pheromone, and it got shorter if they were exposed to the follicular pheromone. Oh, my cat is trying to climb onto the computer right now. Stop it. Okay, some other support for human pheromones. McClintock's done a lot of work on this. One interesting study that's recently been done is smelling a derivative of anabolic steroids can activate the hypothalamus and stimulate the release of that gonadotropin releasing hormone. And this occurs in heterosexual women. It also occurs in homosexual men. So people who are attracted to other men smelling a derivative of steroids that are more prevalent in men will actually activate and kind of stimulate that ovarian cycle. But it doesn't occur in homosexual women or in heterosexual men. So if they are not attracted to men, then we don't see this effect. So this is really interesting. Unfortunately, this has not been studied in bisexual individuals, though, because I think that would help us kind of clarify what's going on here a little bit. And then finally, just something to point out here. Illness will suppress female sexual behavior, but it doesn't suppress male sexual behavior. So females with low energy or poor condition are going to be less attractive to other males, have less receptivity and less proceptivity. It's thought that it's the activation of the immune system that will inhibit the gonadotropin releasing hormone expression, decrease that circulating luteinizing hormone. When luteinizing hormone drops, sexual interest decreases as well, and inhibit that steroid hormone synthesis in the gonads. So here's a study. What we're looking at here is on the right here, times males spent with females, treatment of female. And so we could induce kind of the illness by injecting these cytokines that are normally activated when they're sick. So just the injection of those cytokines, you can see the males spent less time with those females than with female control subjects. However, with males, this is times females spent with males, there's no difference between the groups. Females don't discriminate between males who are sick or not. And it's thought that this might be related to differential effects of the reproductive success of males and females. For a female to become pregnant requires a huge amount of energy and nutrients, and she really needs to be in good health to carry that pregnancy to term. Whereas with males, they do not have to be in good health to pass on their follicle, the sperm, and impregnate the female. So it doesn't matter as much.